It's natural for us to experience love, joy, grief, adversity, vulnerability, injury, illness. We are all flawed. We are all unique. That's what it is to be human. I've lived, I've loved, and I've worked with too many spirits who have been touched by mental illness and suicide, directly and indirectly. My late mum, she spent most of my childhood in and out of psychiatric hospitals. And for years, I felt such a cruel child, thinking, how could I hate my mother and love her at the same time? And it would only be years later that I realised it wasn't her that I hated, it was her illness. More recently, my beautiful young teenager has been navigating her own adolescence with mental health challenges and some hospitalisations. Yes, since my childhood, there have been some occasions and days when I have thought about, tried to die. I have a psychiatric history as long as my arm, but I've also been able to turn this psychache, that undescribable pain of which disconnects me from my very being, to a positive. Recovery is doable with the right elements in place. And I am one of the lucky ones. I have it all. I have a wonderful family. I have friends that I'm rich with. I have a meaningful life, that I do things that I enjoy and love and am passionate about. Recovery, it's doable. It's a journey. It takes time, it takes work, it takes effort, and we can't do it alone. We need human connectedness. We need help. We need support. No one can do the work for us, but we need that encouragement to be socially included. Caring for a loved one 24/7, waiting on edge, thinking, is this the day that there may be a potential tragedy, a loss of life, or someone self-injures seriously? That's really living on the edge when you're loving someone with a mental health vulnerability. The WHO, the World Health Organization, estimates that approximately one person every 45 seconds takes their life globally. That's approximately 1 million people a year, 90% of whom have a mental health-related problem. These are our children. These are our grandchildren. These are our parents, our friends, our colleagues, our grandparents, you and I. And yet, what's our biggest barrier? Mental illnesses are discriminated against. Not by the very illness. The illness doesn't discriminate. Any one of us is vulnerable. This touches every single one of us. What it does do, though, is it's society and people who discriminate. And so we need to change some of our attitudes and thinking, because we are, at the end of the day, human, and we will all experience injury and illness of any form or any description. Having been an advocate now for 16 years, I've been out and about doing a lot of these presentations to thousands of people across different countries. And what's always amazed me has been the reaction to when I come out and share my own journey of illness to wellness. Some of them have been very negative. Overwhelmingly, they're mostly positive. But the negative ones are the ones that actually really fascinate me. I've heard that, oh, she's doing this for her 15 seconds of fame. I've heard that, oh, she's attention seeking. Oh, she's such a drama queen. And I have heard that, oh gosh, she must be making lots of money. Well, the other one that I really do like is how morbid and negative. What an awful subject to talk about. My darling husband has a really good view on this. He says, what have you got to worry about, Ingrid? It's my surname that's out there. Well, thank heavens it's common in Latvia, because then we're not recognised in Latvia so easily. The reality is we've got to change stigma so that we can actually help people who are vulnerable. I'd like to ask you, the audience, to please raise your hand if you've recently or in the last few years gone to visit a relative with a physical health problem, whether it's at their home or in hospital. And how many of you did you take chocolates and flowers and gifts? Yes, that's pretty much the normal practice. How many of you, please raise your hands, have actually gone to visit someone who had a mental health problem or illness recently? And how many of you took flowers and chocolates? At least you went. Thank you, because that's when we need you most. That's exactly what we need, is that human connectedness, that human touch is so important. Brené Brown is a very popular research storyteller and expert in vulnerability. And she's done a lot of TED Talks around the world. And she talks about the notion that vulnerability is the antidote to shame. And that by laying ourselves bare, by sharing ourselves, we're actually building compassion and strength. And I can see that over the years I've turned my vulnerability, well, actually I haven't turned it into strength. It is my strength, just as my strength is my vulnerability. As with Brené, I've shared with so many people my journey. And as I mentioned, yes, there have been a few negatives, but overwhelmingly, it's as if we open the door of permission to be okay to be human, to be okay to talk about this. And that's exactly why I'm doing what I'm doing. I'm tired of the secrets. We need to talk about this. Yes, it is uncomfortable, and let's accept that it's uncomfortable, but be brave and courageous. I would like to invite you all to join us in trying to lower the stigma and lower the stats. And we don't have to be medically qualified to do just that. It's about reaching out, giving other people hope, a sense that they are not isolated and not alone, that it's okay to be human, it's okay to be vulnerable, it's okay that people value each other and care about each other. Our psychiatric history hasn't been that good. If we look back over the years and over the centuries, there's actually a really dark history. We've treated psychiatric patients appallingly. Many have been incarcerated into lunatic asylums. And yet how strange. An asylum was meant to mean sanctuary and protection. And yet in these very places, so many people were tortured, abused, restrained. They had their identities stripped, their citizenship stripped. They were devoid of any human rights or liberties. And many were left to languish and die for indefinite periods of time. Deinstitutionalisation happened some 70 years ago to try and change this so that it would be far more humane how we treated people with vulnerabilities such as these. Now, it wasn't supposed to be a money-saving exercise, and yet that's exactly what sort of happened. And so along the way, as it's turned out, we actually didn't quite do the transition from deinstitutionalisation to mainstream care very well. And in fact, there have been a lot of holes where people and cracks that people have fallen through and ended up, unfortunately, in poverty, homeless, or in prison. So this is where advocacy started, and families came together around the globe to support each other, and with that growth came a new movement, a global movement of human rights to change and revolutionise how mental illness, suicide is treated and perceived. And what the vision of this global movement is to turn the medical model upside down on its head, to change the paternalistic, the controlling, the all-knowing, this is what you must do approach to care. The vision is instead to actually have a holistic view, a holistic, humanistic, patient-centric, person-centric, whole of life that's socially inclusive of people and activities and doing meaningful work, activities and whatever life brings you. Now, we've got a lot of work to do in this space, and yet that's the interesting word. Having a mental illness doesn't mean we are incompetent, doesn't mean that we aren't capable or intelligent. So we're trying to change that view. And the very fact that we're in these advocacy roles now, so many of us are working in this, behind the scenes, working on this model of recovery and social inclusion as a way for our own wellness, but also finding that we can support one another who are also in the same situations or similar journeys. Mental illnesses, they've been treated so disrespectfully over the years, and yet they're a part of us. You can't separate physical from mental illnesses. We're one being. We have one and the other. And so what I'd like to ask you to do is to think about how we all treat ourselves and each other. Mental illness is something that's treatable, we can recover, and we can help reduce the suicide rates. But what we need is a different approach, and that approach is about us as a community, as society. Now, as a student here at the university doing a master's in mental health recovery and social inclusion, this has been a walking example for me, not only personally, but professionally. It has shown me the power of education, social inclusion, being part of something with meaning that's enjoyable and connecting with people, with peers. It's a program that has global implications because it can show us and our community how we could potentially embed some of these philosophies and ways of caring for people into real practice and into the system. And we've got a long way to see our vision become reality globally. Now, some parts are doing their job in different areas and the quality is improving constantly, but this is not consistent. So we need your help. One way is for us all to get behind the movement. Since this touches us all, by being involved in our local mental health groups, by being involved with our politicians and giving them a really good shake-up and making them realise that social impact comes from people power, that we can make a difference. And we can actually make a huge difference and save people's lives. I'm really excited because I actually think we can do this, that we can actually build communities and a society where we can actually step by step, person by person, make a difference so that we can participate in life in a healthier, more contributing manner and way. Not just for this generation, because I suspect it's not going to happen here and now, but more for the generations to come. The key is human connectedness, and we can't underestimate the power of what we can do for each other and how we can reach out and help each other. One final story. My young daughter, when she was little, she actually noticed that something wasn't quite right with Mum, and she took me to bed, tucked me in, and said, "Just wait a moment, Mum." She ran away, came back with a pile of books, tucked in next to me, and started reading. She put her hand on my face and said, "Mum, I love you. We're going to get over this together." That hand on my face, that skin-to-skin touch, that soul-to-soul, heart-to-heart connection, that was the best dose of Prozac I could have ever asked for. Thank you.